Hello, everyone. This is Dr. Clark, the Center for Weight Loss Success. Tonight on Losing Weight USA, we're going to talk about some of the vitamins. I think they labeled this as kind of vitamins essential for weight loss. We're going to basically go through some of the vitamins and kind of why they're important, which ones are more important during weight loss, and can some of them actually help with weight loss, and hopefully answer a bunch of those questions. All right. Here's the official welcome. Welcome to Losing Weight USA, real-time answers to your weight loss questions, as well as some of the latest updates and research, some expert advice, gives you direct access not only to me, but you should be receiving the health tips and recipes via the membership portal. If you think of questions during the presentation, type them in the chat box. We'll get to them at the end as time permits, and we'll typically make time permit. If you think of something once we're all done, just give us a yell here at the Center for Weight Loss Success. The email is success@cfws.com. Phone number 757-873-1880. All right, so let's flip this over. Maybe. Here we go. All right, very good. So what are we going to talk about? A little outline. Okay, we'll talk about the micronutrients, that's really the vitamins. Okay, some key vitamins and minerals, components of a good multivitamin. We'll also discuss a little bit what's the difference between pharmaceutical grade vitamins versus over-the-counter vitamins, and are they different? Is one better than another? Should we utilize one versus another? And then finally, what do I typically recommend? All right, so let's dive in if we can get this going. Maybe. Here we go. All right, so vitamin minerals, and your body requires them in small amounts. Okay? It keeps you functioning properly. That's kind of the bottom line. So we can't do without these. They're often referred to as micronutrients as opposed to macronutrients. Macronutrients are what we get calories from, specifically, protein, fat, carbohydrate. Whether you could throw alcohol in that, because we can't get calories from that. Okay? So micronutrients versus macronutrients. So we're talking about micronutrients today, vitamins and minerals. So vitamins are essential non-caloric nutrients that assist your body in biochemical equations. All these things that keep us living are really ongoing biochemical equations. They have to keep occurring. They have to ongo all the time, from keeping us breathing, heart beating, brain functioning, all these type of things. And these micronutrients are important to keep these things working. Okay? And they typically make these equations that are ongoing run more efficiently. It's not like they can't, some of these equations can't run if the vitamin levels are low or minerals are low. It's just that we want them to run more efficiently, kind of optimally. Now, minerals are also, they're elements. They also needed in your body. We require them. Little different than in actual vitamin, but a mineral is basically, again, they're literally in the ground. Okay, these minerals, they're elements that we need, but they're typically not necessarily something that kind of they are different. I guess I'm not explaining that well. Vitamins, minerals, completely two different things. Minerals are typically, they are elements, whereas vitamins are compounds that literally we need, but they're not actually, and they may be made from elements, but okay, their vitamins themselves are a different thing. Okay? Most of these can be obtained from food. Okay. A lot of times we don't actually get optimal levels just from food. Okay? But reality is we can get most vitamins and minerals from our food. And the vitamins can actually be divided into two groups, water-soluble vitamins versus fat-soluble vitamins. The water-soluble vitamins are vitamin Bs, so the B complex, all the B vitamins, and vitamin C. Those are the water-soluble ones. The fat-soluble vitamins are vitamin A, vitamin D, vitamin E, and vitamin K. Three of those, the A, D, and K, are really important for healthy bones. Okay, vitamin E is a good antioxidant, but we're going to go through all these things and kind of talk about them and why they're important and how to get them. Okay, so fat-soluble vitamins, we'll start there first. That's A, D, E, and K. Vitamin A is important in vision. So it's that kind of, if your mom told you to eat your carrots, it helps your eyes. Well, yeah, that's what we're talking about. It's vitamin A. And it's actually not the vitamin A, it's the retinol that's in there. And the retinol is converted to vitamin A. And so subsequently then, yes, it's very important for your vision. Okay, so important in vision, it maintains eyes and skin, but also bone, tooth growth, immunity. So again, you're going to see a common theme here with healthy bones, very important for vitamin A. Vitamin D, we hear about it all the time nowadays. 15 years ago, not so much. Literally half the population is vitamin D deficient. 95% of my surgical patients are vitamin D deficient. And typically, the more overweight someone is, the more likely they're going to be vitamin D deficient, because vitamin D also plays a role in weight. When we have low vitamin D, it's a lot easier to gain weight, harder to lose weight. When we have normal vitamin Ds, it's easier to lose weight and kind of protect that. But vitamin D also aids in bone mineralization, and it helps by increasing calcium absorption. And typically our bones are made out of calcium, magnesium, phosphorus, a bunch of minerals, but then they're held together in a matrix, which is all amino acids, protein. Okay? But also vitamin D helps prevent certain cancers, helps prevent heart disease, helps prevent some neuropsychological disorders. So kind of vitamin D deficiency can be involved in all kinds of different problems. Weight is also one of them. Vitamin E, as I mentioned a few minutes ago, is a really potent antioxidant. It protects cell membranes. Literally every single cell in our body has a cell membrane around it, and you want to have healthy cell membranes. And it helps decrease tissue inflammation. So it's a really good antioxidant, decreases inflammation. Vitamin K, again, we're going back to bones, also helps with blood clotting. There are actually 3 different types of vitamin K. I'm kind of oversimplifying this. One of them affects blood clotting, one of them affects bone, and the other one doesn't have a whole lot of, we're not really sure what all the things that it does. Haven't found something really, really important that it does. But there are actually 3 types of vitamin K. The blood clotting one, that's K1. The bone formation is K2. Okay? So just to complete that thought, often if someone is on a blood thinner, they're often told, Coumadin being an example, they're often told don't eat a lot of things that have a lot of vitamin K, the leafy green vegetables. Okay? That's really not true. Okay, it's really the K1, and typically you'd have to eat a mountain of it to really affect it. But it's the K, when people take extra vitamin K for their bones, which I do recommend, that's K2. And so K2 doesn't affect your blood clotting at all. Okay. But it is the vitamin A, vitamin D, vitamin K, very important in bone formation, healthy bone formation. All right, the water-soluble vitamins, that's vitamin C and the B vitamins. There's actually 8 different B vitamins. Okay, we'll start with vitamin C. Vitamin C is also a potent antioxidant. Antioxidants I think we've talked about antioxidants in the past, but basically they prevent there to be oxygen radical damage. Okay, when your body needs oxygen, we can't live without it, but as oxygen breaks down, it can get into oxygen radicals. And oxygen radicals typically can cause damage to your cells. So kind of an antioxidant then helps prevent that. So an antioxidant maintains good, healthy connective tissue. It supports your immune system. It boosts iron absorption. Vitamin C, very important in a number of things. Okay. And then the B vitamins. We often refer to all the B vitamins as B complex, but there are actually 8 different B vitamins. Thiamine, niacin, riboflavin, folate, B6, B12, biotin, and pantothenic acid. So there's 8 different B vitamins. They all aid with energy metabolism. We sometimes refer to B vitamins as energy vitamins. And that's kind of a mislabel because the B vitamins themselves do not give you energy. What they do is they help the energy-producing equations run more efficiently and effectively. So yes, they help with producing energy, but the B vitamins themselves don't actually give you energy. The kind of comparison there is like, you think about the oil in your car's engine. Okay, the fuel for your car comes from gasoline. But if you don't have oil in the engine, it's not going to work. So as B vitamins help you produce energy, they don't actually give you the energy, but you do need them to produce the energy. So certainly it aids in energy metabolism by helping the body metabolize the carbohydrates, protein, and fats, because that's where the the substrates for our energy comes from. It's the macronutrients, the carbohydrate, protein, and fat. Symptoms of B vitamin, these are kind of generalities. Symptoms of B vitamin deficiency, I'm fatigued all the time, I'm exhausted. Irritability, anemia can be one of B vitamin deficiency, can cause anemia, depression, forgetfulness, loss of appetite, which a lot of people, patients I see wish they'd lose their appetite. But in this instance, not necessarily a good thing. Skin problems and also impaired immunity. So it actually, you can see there's all kinds of a very broad, uses for these B vitamins. And so subsequently, yes, they're involved in all kinds of metabolic processes. Minerals, minerals different than vitamins. Minerals are inorganic, non-caloric substances. So inorganic, they're basically elements, and your body requires small amounts of them to ensure proper functioning. People think about calcium all the time, because calcium for bones, right? Osteoporosis, that's calcium deficiency. Well, it's actually more likely a B vitamin deficiency, testosterone deficiency. Other than that, it's actually a rare person that doesn't get enough calcium in. That's slightly off topic, but not too much. So we often think of that, we often take extra, a lot of women take extra calcium. Some people need extra sodium, some people need less sodium, some people need extra potassium. These are all minerals. So they're inorganic, non-caloric substances that your body requires in small amounts to keep us functioning properly. They perform a number of essential duties, including water balance. Sodium's a big one there. Sodium helps us keep water. Too much sodium, you retain water. Too little sodium, you won't be able to. It assists in muscular contraction, magnesium, sodium, potassium, muscular contraction, transmitting nerve impulses. So yes, we want to transport the messages along these nerves. We want the muscles to work. Yes, we have to have these minerals in the correct, amount. All right, so we'll go through kind of each of them. Kind of this again, the 30,000-foot view. Calcium, absolutely essential in bone formation, water balance, muscle contraction, and relaxation. If you don't have enough calcium, the muscles go into tetany. They can't relax. Blood pressure maintenance, and that's why some blood pressure medications, calcium channel blockers, that's what they're talking about, is blocking some of the calcium so the muscle relaxes some. Secretion of essential enzymes, and as well as secretion of hormones. Calcium is a very important one, but actually it's relatively rare we're calcium deficient. Now, for someone who's osteoporotic, yes, over years and years and years, they've had too little calcium. But most of us actually take in enough calcium if we could utilize it correctly. And that's where the vitamin D comes in, the vitamin A, the vitamin K comes in, other hormones, estrogen, testosterone, all that stuff. Phosphorus. Phosphorus is also important in bone mineralization, because part of bone is not just calcium, but it's magnesium and phosphorus, as well as energy metabolism. We talk about your energy level. We're talking about something called ATP. ATP is adenosine triphosphate, phosphorus. And ATP is your money, so to speak, of energy. It's ATP that gives you the energy. We have to be able to break down ATP in order to provide energy. Magnesium, very important again in bone mineralization, but also protein synthesis, enzyme activity, muscle and nerve function. Again, you need magnesium for muscle relaxation, immune function. If you tend to muscle cramps, dehydration is one of the most common things, but actually you very likely need extra magnesium. There's a lower amount of magnesium, you can fix muscle cramps. Sodium maintains pH balance in our body. It's essential to muscles as well as nerve function. And this is the big one for regulating body water and blood pressure. Some people are very sensitive to a little extra sodium makes their blood pressure go up. And that's mainly water retention. Now, a lot of people aren't sensitive to sodium making their blood pressure go up, but some people are, and they do have to be very careful with their sodium intake then. Potassium also a very important element, a mineral there. Okay, so potassium maintains fluid and electrolyte balance. It assists in nerve function, muscle contraction. So again, all these things we can't live without. We need to get them, but typically we just need very small amounts each day. So it's not like we need a whole lot. We need small amounts each day. Iodine's also kind of a mineral, absolutely essential for thyroid function. And most Americans don't get enough iodine. Okay? Literally, the thyroid gland itself needs about 3 milligrams a day in order to function appropriately. Now, the RDA, for some reason, is like 150 micrograms, which makes absolutely no sense at all. It used to be thought that iodine could actually cause people to have goiters, but typically it was iodine deficiency that causes goiters. And so when people, if they're very deficient in iodine, they start taking our iodine, the thyroid gland starts working really well, and actually it may swell a little bit. But that typically is a very temporary thing and usually means you needed the extra iodine. So it's absolutely essential in thyroid hormone, which the thyroid hormone is responsible for regulating your overall metabolism. Okay, so absolutely essential for metabolism. Iron, okay, iron and iron deficiency is one of the most common nutrient abnormalities, much more common in women than men, because women, they have cycles, and so subsequently they lose some iron each month. Okay? But it helps with carrying oxygen in the blood, and it's absolutely required for energy metabolism. So when people have low iron, even if they don't have low blood count, if they have low iron, they often are just fatigued all the time. So iron deficiency is one of the most common deficiency, the most common nutrient deficiency. And the symptoms are, yes, fatigue, just weak all the time, but also you can have impaired immunity, meaning that your immune system fighting off infections doesn't work very well. Okay? So iron often, in just another little digression here, the definition of a woman's multivitamin generally means there's extra iron in it. Okay, that's what makes it a woman's multivitamin. Okay, just to take that a step further, if you talk about senior vitamins, usually they have extra B vitamins in them. Okay, so that's the difference. So it's not anything huge. It's making it either a senior vitamin or a woman's vitamin. Generally, it's just some minor changes they did in how much of each of these are in there. Zinc. All right, zinc, very important for many different enzyme systems. Absolutely important for immune function. So if skin problems, zinc can help with that. Literally, zinc is also important in testosterone metabolism. So one natural bringing up your testosterone, actually extra zinc can actually help with that. There is some fun, that can actually help prevent colds and things like that. It's like, yeah, there actually is. So it helps a lot with immune function, but also many enzymes. Okay? So zinc is very important. You just need tiny little amounts, though. Okay? And you'll see some of the multivitamins from A to zinc. That's the zinc in it. Okay, I can't remember. Is it Centrum that used that from A to zinc? I think that was one of their taglines or something like that. Chromium. Chromium you hear us talk about all the time, because chromium's a mineral that does specifically affect carbohydrate metabolism. So it works closely with insulin to regulate and release energy from glucose. And what we see is with chromium actually can help smooth over big blood sugar swings. So it's very important in carbohydrate metabolism. It can smooth over blood sugar swings. Low levels impair insulin activity. And so often that leads to higher blood sugars, which then subsequently leads to also higher insulin levels. So chromium can be something that can help. Okay? Used to be sold as kind of a weight loss medication. It's not a medication. It's just a mineral. It's all it is. But it used to be sold as a weight loss medication. Okay, well, it can help with weight loss, but the way it works is that it helps prevent big blood sugar swings, which then prevents insulin swings. Which insulin, again, the hormone that turns on weight, fat storage. So kind of if we can do anything that kind of lead to smoothing over blood sugars, it can potentially help with weight. And chromium is a very safe mineral too. You can take actually big doses. So if people are like sensitive to, sodium amount and things like that, you don't want to take too much potassium. So there are things you do want to be a little careful with. But with chromium, you can actually take great big amounts, and it's not going to harm you. That's a generality. So I don't want you going and taking a bottle of chromium every day and say, Dr. Clark said it was good for you. Okay, there's a limit to anything. Okay, but literally you can take fairly large doses. You can take 6 times a normal dose and actually be fine. Components of a good multivitamin. So we're kind of taking this all together and all these different vitamins. What actually makes a good multivitamin? And multivitamin basically means it's got all these vitamins in it, okay, and usually some of the minerals. Okay. It's generally hard to have all the amount of minerals in a multivitamin because the pill would be so big. Okay? Because typically the minerals themselves in the right amount or typical daily amounts is sometimes bigger than a multivitamin would be. So if you started putting all these things together in one thing, it would make the pill huge. Okay? So they'll separate. Typically most multivitamins with minerals will have some magnesium, some chromium, a little bit of calcium in it, but they'll typically have the multivitamins. So a multivitamin supplement should provide all the vitamins in a dose that's pretty close or exceed the RDA. Now, little qualifier on that statement, RDA. RDA means recommended daily allowance. Now, the recommended daily allowance is the absolute minimum amount which will prevent a deficiency syndrome. So it has nothing to do with an optimal dose of a vitamin and mineral. What it is, it's the absolute smallest amount that will prevent a deficiency syndrome. And, literally, if you're taking that small, so just because it has 100% of the RDA has nothing to do with, is it actually a good amount or could this actually help you? It's like, no, you're taking the absolute smallest dose possible to prevent a deficiency syndrome. Nothing to do with the optimal dose. Now, for most nutrients, vitamins, minerals, and that, the actual optimal dose is unknown. We don't really know what the optimal dose is. Now, the other end extreme of that is that taking something that has 5,000% of the RDA is probably a little much and probably superfluous, and typically you don't need that much. But don't read too much into that, something is, 150% of the RDA. It's like, okay, that may be just barely more than what you need to prevent a deficiency syndrome. Now, again, we often don't know what the actual optimal dose is. And for most things, you can take fairly high dosing. Qualifier on that is, kind of the water-soluble vitamins, you can take pretty much high doses. You'll just wash them out if your body doesn't need them. The kind of the fat-soluble vitamins, potentially you can overdose, but you really would have to take really high doses. Okay? And actually for vitamin D, in theory, you could overdose on it. But if you take it with the vitamin A and the vitamin K2, you really can't overdose on it because the 3 vitamins work in synergy and it prevents you from actually utilizing too much or too little. All right, got a little off track there for a minute. So pharmaceutical grade versus over-the-counter. Okay, what does that actually mean? Pharmaceutical grade vitamins are made under the conditions set forth by the American Board of Pharmacy, which means they're stricter. It's like there's a higher bar to get over, so to speak. Okay? So it also means that you can trust it for what's in it, the content, as well as ensure the best absorption and best utilization. Over-the-counter vitamins are not FDA regulated. So over-the-counter vitamins are not held to that same standard. Now, the labels may look very similar. What it says is in there may look very similar, but that doesn't mean those things are actually in it because nobody's checking. And there may be extra things in it that you don't want in it, whether it be contaminated with whatever, okay? Nobody's actually keeping track of all these things, okay? And studies have shown that over-the-counter vitamins may not actually match what's on the label, not even close, and potentially they have extra things in it. So what does that actually mean when I say, gee, what vitamins to take? What do I recommend? Okay, I do recommend taking a multivitamin. Pretty much everybody ought to take a multivitamin. Okay, now, does it have to be a pharmaceutical grade multivitamin? Maybe. The reason I say that is, okay, pharmaceutical grade vitamins are a better quality product. Okay? Most people, or excuse me, many people actually utilize and feel better with pharmaceutical grade vitamins. There are good over-the-counter vitamins. And what I recommend people do is don't get the generics. Get from the companies that actually do this as their job, so to speak. The Centrums, the One-A-Days, these are the people that they made their reputation kind of making these multivitamins, and this is what they do. So I would use definitely a name brand if you're not going to use pharmaceutical grade. Typically pharmaceutical grade costs a little bit more, but you also may get a lot more out of it too, and it isn't that much more. So just about everybody ought to take a multivitamin. Just the typical American diet is just not a very good diet, even when we're trying. If say we're eating all whole food and that, the issue there is that all the vitamins and minerals that are in whole food nowadays really aren't the same as it was 50 years ago, because so many of the vitamins and minerals have been leached out of the soil, and all of some of the things that are put back into the soil may be contaminating some of those things. So multivitamin, getting it all from food may not really be as feasible as we'd like it to be. So I think everybody ought to take a good multivitamin. Just about everybody needs extra vitamin D. I mentioned earlier that 50% of the population runs low on vitamin D. 90% of my patients and 95% of my surgical patients run low on vitamin D. So pretty much everybody needs it. Vitamin D is best taken with vitamin A and vitamin K2. What we had them do is put it together as one little vitamin. It's the vitamin D you need, but the A and the K with it, they work in synergy. Okay? So I think just about everybody needs multivitamin, vitamin D. Best taken is A, D, and K. Other things that can be helpful, but these are more second tier. Okay? Essential fatty acids. Yes, they can be helpful. There are health benefits to nerve function, muscle function, my thinking clearly. B vitamins can be very important for nerve function, muscle function, fatigue. Yes, they can be helpful, but not everybody needs them. Extra magnesium, potassium, these are minerals. Yes, anybody can utilize them. Many people could actually use them, and we're better off with them, but that doesn't necessarily mean they're deficient in them. Other things that can be helpful. So multivitamin, vitamin D, top tier, next down be essential fatty acids, B complex, magnesium, potassium, and then other things that potentially can be helpful. Calcium, and calcium more likely need vitamin D. Chromium, we talked about, yes, it can help smooth our blood sugar swings, help with cravings. Iodine, most people could benefit from that. Chelated iron. Chelated iron, if you're iron deficient, chelated iron means the iron molecules are connected to a couple amino acids. And so subsequently then they're more efficiently absorbed. If it's more efficiently absorbed, you can actually take a smaller dose and get plenty out of it. Because a lot of the problems with taking iron are the potential side effects. Constipation, nausea are common ones. Okay. Then I threw an extra one down at the bottom, carb blocker. Carb blocker, people often ask about this. It's basically an enzyme, and it kind of blocks the enzyme that absorbs carbohydrate. It'll work for a very short period of time. And so if you take it right before you have some carbohydrate, it can block the absorption of some of the carbohydrate. It can block about 25 to 33%. Doesn't work well if you're having a high carb diet, but it can be helpful if you're on a low carb diet and you're either going out to dinner, you're going to stray some tonight, or have a little extra carbohydrate. Doesn't work to do it after the fact. You got to do it shortly, right before you're having that carbohydrate, typically within about 15, 20 minutes, because you're blocking the enzyme. It's a very temporary thing. And so subsequently, it makes some of the carbohydrate that you've taken in, it makes it more like fiber. It's not absorbed. Fiber is basically a non-absorbable carbohydrate. So if you can block some of the enzymes, the carbohydrate you take in will act more like a fiber as opposed to being absorbed as a sugar molecule. All right. Throw this up here. Back on Track After Weight Loss Surgery, book Dr. Reese and I put out. It's been probably 5 years now. We also have digital program that people can do. So if you're struggling after surgery, it's a good way to get it. You can get the book actually from the store, but also you can get it on Amazon. Questions. If you have questions, I don't see something written out there at the moment, but if you think your questions about vitamins, don't hesitate to ask. The Girls Nutritional Store typically are pretty up on vitamin mineral stuff. But if you have questions, you're coming in and see me, hey, we can talk about those. All right. Very good. Well, thank you all for listening. Okay, you should be stopping by the center and getting your body comp done. You want to make sure you're losing fat, not losing the lean body mass. Harp on that all the time. You should be receiving the health tips as well as weekly recipes. Tune in each Tuesday, 6 o'clock for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good evening, everyone. Take care.